I wanted to talk to you a little bit about what I suggest that you do when you check your blood pressure at home. And these are the types of things that I talk to my patients about. So let's start with the different types of cuffs that are available. This is an example of the digital blood pressure cuff. Here's an aneroid blood pressure cuff, which is the type that has the bulb that you would squeeze. And then we got a mercury sphygmomanometer. So if you want to go buy one at a museum, I guess you could buy one of those. But what I suggest is a digital cuff. And then beyond that, I suggest the one that would go on your upper arm, not the one that goes on your finger or your wrist. The ones on the upper arm are more dependable and trustworthy as far as the data that they give you. And so if you're going to use that one, how do you size the cuff that's going to go on your arm? Or what you're going to do is you're going to take your left arm, you're going to go halfway in between your elbow and your shoulder, and you're going to take the circumference of that part of your arm, and then just use that data, how many inches it is, and go to whichever manufacturer you're going to purchase and look through the list of cuffs that they have to make sure that you have the right cuff size. And then, of all those digital upper arm cuffs, I've done some basic research on these, and I found that Omron, which is Omron, tend to be the most reliable. I don't get paid any money by this company, just based on my research. That's what I found. Even with that, you could expect that you might get anywhere from 5 to 15% variability on what is your true blood pressure. So you may consider taking your blood pressure cuff to your doctor's office and comparing your cuff to the amount, the blood pressure that they get when they're at the office. So let's go back. You've chosen your blood pressure cuff, and let's now go and talk about what you need to do in the moment when you're going to take your blood pressure. So what you want to do is you want to start by waiting 30 minutes after using caffeine, alcohol, or tobacco products to make sure that these don't create an effect on your blood pressure reading. And then on top of that, you want to make sure you have an empty bladder, because this can change your blood pressure as well. You want to rest for 3 to 5 minutes after, any type of stressful events, driving on the highway, upsetting conversation, anything beyond that. Try to give yourself a little bit of time to rest after something like that to get a dependable blood pressure. You want to sit in a comfortable position, legs uncrossed and your back supported. Then you want to have your arm elevated, so it's basically at the height of your heart when you measure your blood pressure. Wrap the cuff around your left upper arm. Have it be bare. You shouldn't have your shirt sleeve in between. And then it should be snug enough that you could barely put one finger in there. And the bottom edge of the cuff should be an inch above the crease of your elbow. And then what I would suggest is to take 3 different blood pressures, just a few minutes apart, and then take the average of that. And that's your blood pressure of the day. So if you guys have any questions, please let me know.